Hello and welcome to my channel. I apologize for my raspy voice from sore throat. So for today's topic, Pancoast tumor and superior vena cava syndrome, we will try and memorize both the topics. So by chanting, okay, I'm not going to explain these disease entity. We are only trying to remember the factual information in a fun way. So you repeat after me, okay? Pancoast tumor is also known as superior sulcus tumor. Pancoast tumor is also known as superior sulcus tumor. Where is the location of Pancoast tumor? Apex of the lungs. Location, apex of the lungs. Symptoms are because of compression of the locoregional structures, okay? So different structures are going to be compressed by Pancoast tumor, and depending upon which structure is compressed, you will have the symptoms. So recurrent laryngeal nerve compression, hoarseness. Recurrent laryngeal nerve compression, hoarseness. Stellate ganglion compression, Horner syndrome. Stellate ganglion compression, Horner syndrome. Superior vena cava compression, superior vena cava syndrome. Superior vena cava compression, superior vena cava syndrome. Brachiocephalic vein, brachiocephalic syndrome. Brachiocephalic vein, brachiocephalic syndrome. Location of the tumor, apex of the lungs. Most common presenting symptom of Pancoast tumor, shoulder pain radiating to the axilla and scapula. Most common presenting symptom, shoulder pain radiating towards the axilla and the scapula. Brachial plexus compression, sensory motor deficit. Brachial plexus compression, sensory motor deficit. Recurrent laryngeal nerve, hoarseness. Phrenic nerve, hemidiaphragm paralysis. Phrenic nerve compression, hemidiaphragm paralysis. How will the hemidiaphragm present on a chest X-ray? Hemidiaphragm elevation. Hemidiaphragm elevation. Hemidiaphragm paralysis will present as hemidiaphragm elevation on chest X-ray. Superior vena cava syndrome occurs because of an obstruction of the superior vena cava. So there is difficulty in draining of blood from the head. Therefore, patient can present with facial plethora. Okay, so a patient will present with facial plethora. Facial plethora. Now, it can have jugular venous distension and upper extremity edema. So all the three symptoms together, how will the superior vena cava syndrome present? Facial plethora, jugular venous distension, upper extremity edema. Facial plethora, jugular venous distension, and upper extremity edema. The most commonly caused by malignancy. Commonly caused by malignancy and thrombosis from the indwelling catheters. Malignancy and thrombosis from the indwelling catheters. It is a medical emergency. So superior vena cava syndrome is a medical emergency. It can raise intracranial pressure. It can raise intracranial pressure. What will be the signs of a raised intracranial pressure? Headache and dizziness. Headache and dizziness. Also an increased risk of aneurysm rupture of intracranial arteries. Increase in the risk of aneurysm rupture of intracranial arteries. Pancoast tumor location, apex of the lung. Gold standard for Pancoast tumor, MRI. Which nerve root pain in Pancoast tumor? C8T1T2. Brachial plexus compression by Pancoast tumor, sensory motor deficit. Okay, the patient can also have increase in the risk of aneurysms and rupture of the intracranial arteries in superior vena cava syndrome. Again, the symptoms of superior vena cava syndrome, facial plethora, jugular venous distension, and upper extremity edema. It is a medical emergency. It can raise intracranial pressure. The two common causes of superior vena cava syndrome, malignancy and thrombosis from an indwelling catheter. Thank you for joining. Have a nice day.